We talk to each other. We have a lot of support across the company for well-being. We encourage a lot of sort of peer-to-peer support when people have a tricky day to sort of share those worries with each other, so that when we do go home to our own families, we're able to focus on squeezing them a little bit tighter, and I think being probably, to be fair, to be grateful that we're in a position that we are able to do that. So I found that really difficult, you know, when families couldn't meet and gather. Funerals are really important in giving families the opportunity to come together and support each other. And it was quite heartbreaking that, you know, on many occasions, they weren't even able to have, you know, the very nearest and dearest there at those ceremonies, and that was really tough.
Is the profession that we've chosen, and for many of us we see it as vocational, and we consider ourselves to be part of our community and our community is part of us. But equally there is a need to get that balance to make sure that this prolonged exposure to trauma doesn't result in compassion fatigue, which can happen when people are continually in that position and they need a level of support themselves.
But I think at a very basic level, not being able to reach out and actually just hug somebody, comfort them, the things that as human beings we would all do naturally when people are in distress, it is really difficult. I remember sadly a burial, I think it was about the third week of the first lockdown, and it was a graveside service. We were stood in the cemetery and there was a young boy of 13, and etched in my memory was him standing there on his own, because actually nobody knew whether or not they were allowed to get close. He was in a different household to his vulnerable grandparents, and it was heartbreaking to actually see the pain on his face.
Yes, it's much harder when they're younger. You know, when you see young people, children, unfortunately we had somebody the same age as my daughter, and that is much harder, because, you know, you can relate to the family, how they're feeling, so it does get much more difficult, I think, to detach then, but it's something that you sort of have to do, because if you didn't, you really would be a complete wreck.
You know, every week I think, I don't have what it takes, I just want to lie down and die. I just want someone to do my own funeral, because this is too hard. And, you know, and there's times I genuinely feel sad. I feel sad with the work that we do, you know, and there's elements of it is very sad. But then I also feel that, you know, I'm doing, or we're doing, what we've assigned ourselves to do. And then we have lots of subcontractors as well, depending on the future. Never did I think this would happen. And never did I think it would affect us, you know. I thought we would just be this bespoke funeral service that does a few funerals a week, and, you know, and work with families and handhold them. And, you know, I was told by a client today that she feels that she hasn't been, we haven't held her hand, and that, you know, that feels really rubbish to me, because it's not who we're about.